I really need a good pair of headphones so I could hear myself talk. Check. Right on, right on. That's my buddy Andy. He's the Kyle Ripken of radio, Bree. Every day, come to play. 7:31 now. Also in the KUAM News Zoom room, Dr. Felix Cabrera, the Chief Medical Officer for the Department of Public Health and Social Services. Good morning.
Good morning, Chris. Good morning, Bree. Good morning, Jason. Good morning, Guam.
Doc, let's go ahead and start because I know that you had gone to the CNMI, and I know a lot of people. I saw something on Twitter where somebody was like, not sure what's open in the States. CNMI trip. Right? Because CNMI, if you're fully vaccinated and you got all your paperwork in order, you can actually take a trip for pleasure to the Northern Marianas Islands, which is a great destination. Right, Doc? You might be a little biased, though.
Yeah, absolutely. So back to the motherland. So what was, the last time I had been on Saipan was December of 2019, the early part of December 2019, and I had not been able to visit home in that amount of time, in about a year and a half now. And so, as soon as the CNMI announced that they were going to have these opportunities for quarantine exemption if you've been fully vaccinated, jumped right on the opportunity and said, I think it's time for me to finally take a break, through this pandemic. And so, even though I was there, still be able to do some telework, which was great, but wasn't much. And so I did get a lot of time with family and friends. And so, but ultimately, it was a great experience actually going through the process, and I was extremely, extremely impressed by how organized the process was, and how well rehearsed they were and experienced in the process. And I'm happy to discuss more of that if you want more details.
Yeah, if you could just kind of walk us through what you went through when you landed in the CNMI, and what you did before your trip to prepare.
Sure. Yeah. Thank you. The first thing when I read their algorithm, basically the flow chart, or the matrix as they refer to it, I initially read it correctly that basically if you've been fully vaccinated, and you have proof of that vaccine, which is again is similar to here in Guam, where they want to see that if you're, like, for example, if you're coming from Guam, you've been vaccinated in Guam, they want to see that WebIZ printout that proves that you've been vaccinated, in addition to your CDC vaccination card. And the thing is that all of this is done before you even travel. So they have a health declaration form that's online. You fill that out completely, and it's detailed, and and for good reason. And so you go through that, and then you can upload the image or the document of your that verifies your vaccination, and then they review it, and then basically you get an email saying it looks good, and then you travel. And then you're already in the system as you go there. You don't even have to physically. I actually physically had my the WebIZ printouts and the cards with me the whole time, just as and then nobody ever asked because they already had a copy of it. But what happens is that you go there, and you go through the process line, and then they shuttle you directly to Kanoa Resort, and then at that point everybody gets tested upon arrival, and not just and it's not an antigen test, the actual PCR test. So we check in, we all got swabbed, but then they give you a room. So because the test would take about 2 to 3 hours to come back. And so it was nice actually, after waiting in line for a long time through multiple lines, and then finally being able to get a break and just hang out in the room for 2-3 hours. And they fed us during that time, almost fed us twice even. And so, but at 2.5 hours is when we got the call saying that, all of you are negative and you're welcome to check out at that point. And they still kept track of us using the SARA alert, so daily monitoring of symptoms. So either a text message or a call we would get to verify that we weren't having any symptoms. And then the last bit of this is that on day 5, you have to return to get retested. And so that was the key difference there. And so it was no big deal. And so that was a few days before we were going to leave anyway. So when they're swabbed again and got tested, and at that point they, you get your results via email, and saying basically that we were all negative again. And so it was a really easy experience, and it was great. Would I say I read the matrix correctly the first time? When I looked at it again, I misinterpreted it saying, "Oh, I think we have to home quarantine until the 5th day," but then that was not correct. And they do want to verify your residence and make sure that your home is adequate. But other than that, it's not a home quarantine during that process. And so so it was great, and had a great time, and just came back in yesterday morning, and so it's been good. So I guess that brings me to what my experience was coming back to Guam. And so coming back to Guam, the health declaration form is one form, and it's a physical form. You fill it out, it's very quick and easy. And then after you arrive, before you get your bags, you go through public health screening process, and you present your information, and basically they review it, and then it was pretty straightforward at that point. And then after that, it is informed of that you're going to be a part of the SAR alert here, and that's it. And so it was nice and simple. They didn't have to look me up because I had a printout of my WebIZ, so that made it a little bit quicker.
How close is public health then to kind of digitize that whole verification form, that letter, so you're not walking around with a piece of paper?
Yeah, it's actually very close. And what happened was they had it all set up, but then when we added the need for the additional verification, they had to change the whole. They had to make an adjustment to the whole program to allow for the uploads of the document. So that's really what's been the one thing that's slowed things down. But we should be close, and I'm not sure exactly the timeline for that, but it will be coming soon, because it's extremely important, because it makes things so much quicker.
Right. And so you say makes things quicker. When you came in, I don't know if it was just people from Saipan or the Saipan flight arriving, or if there were any other flights coming in when you did, and if there were, was there a long wait?
Yeah, so it was only the Saipan flight that was coming in, but it is a 737. But also, not everybody's disembarking on Guam. So those who were staying on Guam went through the process, and there's basically two lines: one for the regular public, and then the other for disabled or those with families with young kids. And I was one of the I fit into that category, so I went that way. So that was a little bit faster for sure. But it does take some time, so you have to be patient through that process. And again, it's for the opportunity and the benefit of being exempt from quarantine, which is the main goal. And I think that was that time waiting wasn't too bad compared to everything else that we've been through.
Right, Doc. Before we get into just some general travel tips in this COVID era, like I said, I saw on Twitter some people talking about, hey, NMI trips. So when you go to the NMI, what are, like, let's say the top 5 things to do when you visit the CNMI?
Top 5 things to do? Geez, where do you start? In no particular order, I would say that the beaches and are very beautiful, just as Guam, but the coral reef there's many parts that are still very much alive and very easy to snorkel, so that's great. Obzen Beach, for example, or is one of my favorites, growing up. But other than that, the food, what people don't really realize is how rich the history is in the CNMI, particularly with Saipan, with Japanese culture. So when Japanese food on Saipan tastes very different than Japanese food here on Guam, for example, and it feels more like eating in Japan, and in particular with the sushi. So there's a lot of great restaurants that do that, and like Himawari or Naked Fish even, which is more of a contemporary. And so and disclosure, my sister and brother-in-law own Naked Fish, but it's a classic restaurant with great food. And so you just all of a sudden the flavor there is so different, and that's what I really enjoy about it. And when I go home, I try and eat everywhere. So
Doc, you know, that's
I
crazy because you're right. People don't, I mean, not just in the Japanese stuff, which is great, but I think Saipan restaurants, I mean, even Guam, no, you guys know I love Guam, but I feel like you always got to qualify when you talk good about Saipan. You're like, relax, tomorrow's on Guam, I still love you. But the restaurants in Saipan are killer. I mean, you just stroll Instagram from Caravan of Food to, you know, the Shack, and you're right, Naked Fish. They got this parrotfish nuggets thing there. Oh, God.
yeah.
Good stuff.
Yeah, and exactly, and then you have these fusion with like Casa Urashima, which is just great food, like Japanese and Spanish, or I guess Latin, like kind of mixed fusion, and it's great, and it's like somebody's former house that they turned into a restaurant, and so it feels still like a house in a lot of ways. And so yeah, and you go to all these different restaurants and you feel that flavor, and honestly, it's relatively affordable, all things considered, and so that's what's really great.
Okay, don't all go, guys, at once.
Okay.
Go ahead, Bree.
Well, I wanted to ask Doc, what it was like in Saipan in terms of, they did a whole lot better, than we did through this pandemic. So I'm just wondering what it was like. Was everybody wearing masks? I mean, what was the vibe there?
Well, I think one thing that we all have to be very clear and really appreciate is that the CNMI had more to lose with this pandemic, and particularly being because of the limited, even we talk about our limited resources here in Guam, and our access help and assistance. Imagine it, on a scale that where it was even more difficult for them if there was a major surge into their hospitals. How they'd be able to handle that, and because of that, they were even more and more strict in terms of their quarantine process and so forth, and people taking the precautions seriously. But because of that, they have very little community spread, except for this one outbreak that happened, a few months ago, that was very quickly contained. You have to go back like 200 days before that, since they had their last community spread. And so there you're essentially in a bubble that is COVID free. And so that being said, everybody feels more comfortable when we have gatherings. It was nice, and that I felt very comfortable not wearing a mask in family gatherings. And we did have one of my first cousins who I grew up with got married last week Sunday, and so with the reception, so it was nice to be around family, and it just felt so weird. I just have to say, not wearing a mask and being around so many people and being comfortable hugging and kissing and family members because everyone there has been vaccinated and in a bubble, and so that's what we can achieve here. In short order, I think if more people go out and get vaccinated, and for crying out loud, you have a chance to win $10,000 a week or a car, and so. That I think that's how much more incentive can you get to get vaccinated. So please, everyone, please, because it's a tremendous feeling to be able to feel that free. I just have to say.
Well, okay, vaccine win then. How is it going? I think I heard 19,000 yesterday had signed up.
Yeah, and so and when you look at our overall vaccine efforts, you're getting, we're approaching, we're getting towards 70,000. I'm sorry, 70% of all adults have been vaccinated fully, and so we're approaching that. We're short of that. It's like 68-ish% right now. So we're really moving up there. So basically, definitely more than 2/3 of the adult population has been vaccinated. But we definitely need more of the big number. The one who's really going to make the difference are those who are between 12 and 29 years old. They're the ones that are a big part of the chunk of the population, and they get out, they can get vaccinated, and they can be part of winning, these prizes as well. But the biggest prize is protecting yourself and protecting your family.
All right.
Yeah, but 10 grand in a new car is pretty cool too. Go ahead, Bree.
By the way, I won a car once, or this was
You did?
in
Where
Saipan.
Oh yeah.
Wow.
The American Red Cross. This was back in like 2011, 2012.
Right, right.
And it was a Ford Fiesta. It wasn't even the grand prize.
Wow.
It was the second prize. And
Wasn't
so,
even.
Well,
Wow.
anybody
yeah,
who's been to our
great.
What was the first prize? What was the grand prize? What
I
was
think the
the
grand
car?
$20 or $25,000 was the
Wow.
grand prize.
Yeah.
So of course the car was way less than, worth less than that. But it's great. And just to be, but see, I get to for life, I get to be able to say that that I want a car.
Yeah, yeah.
And so
Yeah.
Well,
that's incredible.
anybody who's been to any of our company Christmas parties knows that I have the worst luck in raffles. Anyway, go ahead.
Before we continue with this interview, I just wanted to give an update because we just got something from
Yeah.
the governor's office regarding the CDC's travel designation for Guam, and it has been lowered at what we were for. So now we're back to level 2.
Right.
So I don't have what exactly that means.
That's breaking news, guys. So yeah, we're level 4. We've been talking about this for the last few weeks, and now the CDC has lowered us to moderate risk level 2.
Right. So the governor's saying this complements a recently updated protocols that allow vaccinated travelers to enter our borders without quarantine. We also have a unique opportunity to share Guam's vaccination success with expatriates in the region, an initiative we expect to roll out shortly. Additionally, I've requested to increase Guam's vaccine supply to enable non-U.S. citizens to travel to Guam for their shots. Do you have any information on that, Doc, regarding this effort to get non-U.S. citizens vaccinated? Because all we've heard about is the Airbnb, which is for expats to come here. So I didn't know there was an effort for non-U.S. citizens now.
Well, I'll say first, address the fact that we have been dropped down into level 2. And that basically that's think about that in the context of us opening up our quarantine process. I mean, or quarantine exemption process, and having that, and that this was a time that we were extremely nervous, and we wanted to wait through two incubation periods, basically of what potentially could be a spread. So that's 28 days or so, and we're about 21 days right now. Since the change from May 15. And so the fact that we're getting even lower cases and we're testing more still and being able to do that says a lot, right? That says a tremendous amount. And so that our confidence in that our plan so far has been, working well, that the decisions we made are the right decisions thus far, and that we are practicing the least restrictive means possible. And so those are very, very important, things that to take note of and be very proud of. And then in that part, because we're doing this well, we had the opportunity to help people, because in the end, every shot that goes into a human being's arm protects more human beings. And so that's one of the key parts there. So there is a responsibility that we have that's beyond just the United States, and that's to other parts of the world. And if we can help get that vaccination, numbers up and in a quicker fashion, that protects us more. And so, we are as strong as our weakest country. And so that's a key thing with this fight here. And so if we help everybody else and we have that opportunity to do so, and especially we have federal support to do that, then by all means, and especially if we get the added benefit of having tourists, come here and enjoy visiting the Mariana Islands, then by all means, let's move toward that.
Mm-hmm. What about since they're coming in here seeking vaccination? What kind of protocols are we looking at in terms of quarantine? Is it still 14 days, 10 days? Because I've heard like the number 2, like 2 days quarantine.
Yeah, it would still have to be the nothing changes in terms of they don't get special process in terms of the main skeleton of the flow chart, right? And that you still have to, if you're not vaccinated, then you still required to have to be quarantined in a government approved facility, and also being able to be tested on day 6 and released on day 7 to transfer to home quarantine, and then up to 10 days total. And so those are still the principles that must be followed. And so if there's different areas that have different proposals, different hotels, different that they can make their proposal on how to do that. And again, it doesn't have to be specifically the government quarantine facility. It has to be just one that we approve. So there's the package that's presented and that it looks good to Department of Public Health and Social Services, and it looks good to the governor and all those who are part of the decision-making process, then that's something that we can consider. And there's no reason to be at this point to be too strict about it. And also our the number of cases that we're identifying in those in quarantine that actually are in the quarantine facility, those who are not vaccinated are going down significantly. And then I think that's a reflection also of those who are traveling into the island, onto the island here, in terms of their risk of having COVID overall, because the cases are dropping in the United States. The cases are technically dropping in the Philippines. So those are our two main sources of travel cases, and we should feel more comfortable in that. And our tourist markets, of course, are the rates are even lower. So there's no reason to be stubborn about this process, and that we want to welcome proposals and review them and ensure that they just meet minimum standards.
Mm-hmm. Yeah, the governor on Memorial Day, she was mentioning how she was hoping to hopefully roll out the new Airbnb program within 2 weeks or so. And you mentioned something about government approved quarantine facilities. Is there currently a list of approved government quarantine facilities?
It's a generic, I just said that in a generic way, that if, let's say, a specific hotel wanted to offer this package, then they will make the proposal and then review what their protocols would be and how it would match. And it would be similar to the Theodore Roosevelt when it came in. They just have to follow something similar to that. And if they can, if they can show really good proof that they can execute it, then it will be, there's no reason to not approve them, I think, at that point.
Mm-hmm. So who does the approval? Is it public health?
It's going to be public health ultimately that would have to review and approve, just like anything else in this pandemic. Ultimately, public health is the ultimate authority in this process. So,
and I guess the hotels haven't started that process yet, or public health hasn't come up with like the checklist on how to become a government approved hotel to be used as a quarantine facility.
I'm currently not the best person to answer that in terms of the timeline. Okay. So I don't know the minutia of that, of who's already been in what process, but ultimately it's something that I know that it's in the interest of these of particular hotels to be a part of this and make their proposals.
Mm-hmm. Okay. Do you have just, I guess, a general idea what does these hotels need to have in order to qualify as a government quarantine facility for this program? And they just present their protocols, what we're going to do. We're going to set aside, this floor for quarantine travelers.
It will, as I mentioned earlier, it will be similar to how the hotels that were involved with the Theodore Roosevelt and how they perform their quarantine process there, and that there has to be a clear way of how that the persons are stayed allowed to be in their room, to be monitored, in terms of not leaving the facility or leaving the main hot zones, so to speak. And then how does how do foods get delivered, how do services be delivered to them so that they can be cared for, and so those are all parts of that. And so so that's again, that's really a lot of detail to go through that I'm not really the best person to comment on all the specifics of that, but
just make it up, Doc. We'll take it. Doc, I actually had a call from a listener here wanted me to ask, because there's a report out of CBS News that the headline, COVID vaccines may not be enough to protect transplant recipients Doctors say the COVID vaccine is our best protection against the virus, but new studies have found for organ transplant patients it may not be enough. I think it's relative to organ transplant patients after receiving both doses not producing low to no antibodies. Have you got eyes on this thing? And I mean, do we have a lot of organ transplant recipients on Guam? Are we weighing the effects of this or?
So just two comments on that is that one is that if you, well, first of all, there is no organ transplant system or process here on Guam. And so if you need an organ transplant, you're definitely, getting it from either stateside or some different country. So that's number one. Number two is that those who receive transplants, they have to be under a significant amount of immunosuppressant medications so that they don't reject the organ. And so in that process, it makes it very difficult to mount an immune response, especially when you're vaccinated. So those results are not surprising by any means. And that it's something that you would think that, yes, it's going to be, it's going to be a problem. So therefore, like organ transplant recipients know they're supposed to do is always take the, extreme precautions when it comes to infections. And so that doesn't change with this. And so unfortunately, because the vaccine it's not effective, as effective, especially, nowhere near as effective if you weren't on these immunosuppressants, that you have to take even additional precautions for yourself and everybody else around you, the family members who are around you, that they have to do the same. And they should especially be vaccinated. And so that's one of the key parts there. Is that if, and so that's why, again, that this is being vaccinated. It's not just about yourself, it's about who you're around. And the best way to protect these particular patients is for their family members and loved ones to be vaccinated.
Thanks for that, Doc.
Yep.
Breen?
No, I think, variants. Any new information about variants?
No new information, no new results than what we've had, and the results that we received, recently were no real big surprise that we know that these it was eventual that we were going to see other variants here and that we're going to be able to identify them. But again, the key thing is that, are they consequential? And if you're with our vaccine rates being pretty good and only room to improve, then that the variants become inconsequential. And really, that's really what the key part is. And the same thing goes with the cutoff, what we think about herd immunity, is that there is no magic switch that gets flipped, that once we reach this number, everything is, we're fully protected. That bottom line is, the more we vaccinate, the more we're protected. And again, those who are not vaccinated on the island only pose a risk to themselves and to the others who are not vaccinated, really. And the CDC at this point, they're not even going to investigate those who break through, who get positive with COVID after being fully vaccinated. They're only really going to look at those who've been hospitalized or have died after being fully vaccinated. That's who they're going to really look into. And thankfully, knock on wood, at this point, there is none to report here on Guam. That all our hospitalizations right now, there's 6 persons that are hospitalized on Guam, 3 at GMH and 3 at GRMC. All 3 of them are non-ICU, and they're not ultimately they're not on a ventilator either. I don't know 100% about these more recent 3, but prior to that, I can say pretty confidently that there have been no persons who've had been fully vaccinated and have been admitted with COVID related pneumonia or respiratory illnesses. And so that's a big thing to be able to say. And so we let's keep going.
Right on. Thank you, Doc.
Okay. And real quickly before we let you go, just travel tips for people who are heading out. It's summer, going on vacation, graduations, things like that.
Yeah. So travel tips, again, it's really, really simple. Masks are still in the key part here. If you're flying, wearing a mask is still going to be very protective. Flying in airplanes itself is not as dangerous as you would think, because they have really good airflow and air filtration rates there. But masking is, if you can wear a double mask, that's even better if you're comfortable with that. So that's really something that I would really highly encourage. And you're required to wear the mask anyway. So there was a person in my Saipan flight during the check-in process that was not wearing a mask, and going around videotaping every personnel that came up to tell him to wear a mask.
Oh God.
Ultimately, when he was on the plane, he was wearing the mask. So
Did you guys give him a little bit of that Saipan broad enforcement? Hey, mind that fanboy?
yeah. So
All right.
All right. Thanks a lot, Doc.
yep, absolutely. Thanks everyone.
Of course.
Okay.
Great talking to you. Have a great day.
There you go.
Stay safe.
Dr. Felix Cabrera, the Chief Medical Officer for the Territory of Guam. This is The Link. Good morning. Good morning, Guam. Right on.
I like how you asked Dr. Cabrera if like they kind of gave him some of that little, let's say, like Saipan street justice.
Yeah, you got to put the two and two together because
Yeah.
they said, oh, the guy was complaining about not